Hi everyone, good day. My name is Frances Niswanaria, student nurse from Davao Doctors College. And today I am going to demonstrate the assessment of the abdomen. So this assessment will help us detect health problems earlier and prevent further complications from developing unexisting diseases. So now review the client's medical record for us to know if there is really need to assess. Then determine the scope of the assessment. This is done for us to know the extent of the physical assessment. Then prepare the necessary equipment such as the stethoscope, the sterile gloves, the tape measure, and of course the client's medical record. So preparing the necessary equipment will save us time and energy. Then perform hand washing to prevent the spread of the microorganisms. Then use gloves as necessary. So now greet the client appropriately, introduce yourself, verify the client using the two identifiers such as his or her name and birthday, then ask how he or she would like to call during the assessment. Explain the procedure to the client, then of course don't forget to establish good rapport so that the client would feel uncomfortable during the assessment. Then provide the client the opportunity to ask or raise for his or her concerns. So now ensure the client's comfort and privacy, position the client appropriately or in a comfortable position. Then if woman, drape the anterior thorax if it is not examined to protect the privacy of the client. Then ask the client if he or she has any history or existing pain of the abdomen. Hello, ma'am. May I come in? So before entering the room, it is important to ask for the patient's consent. Hello, ma'am. Good day. So by the way, my name is Franz, your student nurse for today. May I know your name? Okay, so when is your birthday? So is that okay that I'm going to check for your wristband? Okay, that's good. So, by the way, what would you like me to call you? Okay. So by the way, I'll tell you the procedure that I will be doing now is that I'm going to assess for your abdomen. So this is done for us to know if you have any abnormalities that present in your abdomen. So I'll be touching some parts of your body and expose some parts of your body, and there are some movements that you should follow. Is that okay with you? Okay, so but before that, do you have any clarifications or concerns? So as you can see, I have closed the curtains so that there will be no other people who can see us, and the information that I will be getting from you is secured and safely handed to the doctors. So before that, I have some following questions. Is that okay? Okay. So, do you feel pain in your stomach, or are you uncomfortable right now? Okay. So, do you have any past health history such as incidents of abdominal pain? Okay. How about constipation or diarrhea? Change in appetite? Frequency of defection? Okay. So, what food did you ingest last 24 hours?
Just going some
Okay. So, in a few minutes, we will go into start. Okay. So now let's proceed to the working phase. So surveying the abdomen. So the client should be in a supine position to have an easy access of the abdomen. Then cover the upper and the lower part of the body with a blanket, leaving the abdomen exposed. So now let's observe for the abdominal skin. Not for any vascularities like spider webs. So normal findings is that scattered fine veins is maybe visible. Then the blood in the veins located above the umbilicus is that flows towards the head. So the blood in the veins located in the lower umbilicus is that flows toward in the lower body. So now note for stray or stretch marks. Okay, so normal findings of it is that all silvery, white, stray or stretch marks from past pregnancy or weight gain are normal. So now note for scars, lesions, and rashes. So normal findings of scars is that pale, smooth, and minimally raised old scars are normal. Then the normal findings for the lesions and rashes is that abdomen is free from lesions or rashes. Then flat or raised brown moles, however, are normal and may be apparent. So if scar is inspected, note for the history and document by its quadrant and reference line. So now, let's inspect for the umbilicus, for its color, contour, and location. So normal findings is that umbilicus skin tones are similar to surroundings of abdominal skin tones or even pinkish. Also, umbilicus is in middle at lateral line. So now let's proceed examining the abdomen. So let's first inspect before the auscultation, percussion, and palpation. So now inspect for the contour, round, flat, or distended. So when the client is lying flat, sat beside the client, look across the abdomen at the level slightly higher above the client's abdomen. So it is normal because the findings are the abdomen is flat, round, or scaphoid, and abdomen should be evenly rounded. Inspect the abdominal girth. Inspect the area between the lower rib and the pubic bone and note for any abdominal enlargement. Measure the abdominal girth using the measuring tape at the same time of the day to evaluate if there is abdominal distension of the patient. So can you your back now? So now ensure the client to empty his bladder to prevent the discomfort. So, do you want to pee before doing the assessment? Okay, okay. So now the client should be standing or in a supine position. For orthopneic patient, his or her head may be slightly elevated. Use a disposable, easily clean tape measure, and then if the tape measure is not available, use a cloth or gauze. Then measure the gauze with a cloth, tape measure, or yardstick. Place the tape measure behind the client and the measure starting on the umbilicus and record the distance or the designated units. Take all the future measurements from the same location, especially for the noted distension. So if the distension is present, mark the abdomen with the ballpoint pen to aid the tape measure. So ask the client not to wash the mark until it is no longer needed. So now let's check for the symmetry. Ask the client to raise his or her head to further assess for the herniation or diastasis. Example is the bulge. So can you raise your head? Okay. So it is normal because her abdomen is symmetric. So now inspect the abdominal movement when the client breathes. So can you inhale and exhale for me? Okay. So it is normal because the abdominal respiration movement may be seen in male clients. So now observe the peristaltic waves. Okay, upon inspecting the peristaltic waves, it is normal because the peristaltic waves are not seen, although they may be visible in very thin people as slightly ripples in the abdominal wall. So now let's proceed to auscultation. So let's auscultate for the bowel sounds. Use the diaphragm of the stethoscope and make sure that it is warm before placing to the abdomen. So cold hands and cold stethoscope may cause the client to contract the abdominal muscles, and this contraction may be heard during the auscultation. So apply light pressure or simply place the stethoscope if the abdomen is tender or painful. So perform the auscultation starting from the right lower quadrant, then clockwise. This is because the vowel sounds may be more active over the ileocecal valve in the right lower quadrant. So now listen each quadrant about 4 to 5 minutes to confirm any absence of the vowel sounds. So note for the intensity, pitch, and frequency of the sound. So upon the auscultation, it was normal because the borborygmi, or the loud sound, and prolonged gurgles was heard. So now let's auscultate for the vascular sounds. Use the bell of the stethoscope to listen for the roots. So upon auscultating for the vascular sounds, it was normal because there were no roots sounds heard over the abdominal aorta or the renial. So now let's auscultate for the venous hum. Use the bell of the stethoscope to listen for the venous hum in the epigastric and the umbilical area. So upon auscultating for the venous hum, it was normal because no venous hum was heard over the epigastric and umbilical areas. So now let's auscultate for friction rub over the liver and spleen. Place the diaphragm of the stethoscope in the left and right lower rib cage and listen for friction rub. So the findings are normal because no friction rub over the liver and spleen. So now let's proceed to percussion. So percuss the tone. With the percussion hand technique, slightly and systematically percuss all the quadrants. Percussion may proceed clockwise, up or down, over the abdomen. So, it is normal. There were generalized tympani predominates over the abdomen. Normal dullness is heard over the liver and spleen. So now let's proceed percuss the span or height of the liver by determining its lower and upper border. Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. Note the change for tympani to dullness. Mark the area of the dullness. Okay, so I'm going to percuss now. So now let's assess the descent of the liver. So now locate the liver border of the dullness. Ask the client to take a deep breath. Observe the descent of the lower border of the liver dullness below the costal margin. And deep breath inspiration, and ask the client to hold his or her breath. Perform the percussion and ask the client to exhale afterwards. So, Althea, can you take a deep breath? Okay, exhale. So, it is normal because the findings is on deep breath inspiration, the lower border of dullness may descend from 1 to 4 cm below the costal margin. So now, let's percuss the upper border of the liver. Locate the upper right chest at the mid-clavicular line, then percuss downward. Mark the point where the changes from the upper right chest or the lung resonance until liver dullness is noted. This is the upper liver of the border dullness. So Althea, I'm going to start percussing. So upon percussing, the upper border of liver dullness is located between the left, 5th, and 7th intercostal space. So now, let's measure the two marks. This is the liver span. So the liver span at the mid-clavicular line of my patient is about 9 centimeters. This is usually greater in men and taller guys, and shorter for the shorter clients. So now repeat the percussion of the liver at the mid-sternal line. So I'm going to percuss now. So the liver span at the mid-sternal line is about 6 centimeters. So now let's proceed percussion of the spleen. Begin percussion at the posterior to the mid-axillary line, then percuss downward. Note the change for the lung resonance to splenic dullness. So Althea, can you move your body to the left? So it is normal because the spleen of my patient is about 7 centimeters. Wide near the left 10th rib and slightly posterior to the mid-axillary line. So now let's perform the second method of percussion. Determine the enlargement by asking the client to take a deep breath and start percussing at the last left interspace at the anterior axillary line. So now, Althea, can you take a deep breath? So it is normal because tympani is heard at the last left interspace. So now let's proceed the blunt percussion on the liver. So ask the client to sit his or her back to you. So Althea, can you sit? So now place the left hand fist against the lower right anterior rib cage. Then use the ulnar side of the right fist, then strike the left hand. Note for any tenderness upon percussion. So normally, no tenderness elicited. So now let's proceed to the blunt percussion of kidneys to assess for the kidneys tenderness. Ask the client to sit his or her back to you, then place the left hand into the costovertebral angle. Then repeat the 44th and 45 steps. So it is normal because normally no tenderness or pain is elicited or reported by the client. So now let's proceed the test for the abdominal distension, bulging flanks, and the ascites. So now let's percuss the flanks from the bed upward toward the umbilicus. Note the changes from the dullness to tympani and mark this point. Assist the client to turn it to the side, then percuss the abdomen from the bed upward. Mark the level where the dullness changed to tympani. So I'm going to start percussing now. So can you turn to the side? So it is normal because no abdominal distension, bulging flanks, and ascites. So now let's perform the fluid wave test to assess if there are fluid movement. Ask the client to place his or her ulnar hand and lateral side of the forearm firmly along the midline of the abdomen. Firmly place the palmar surface of fingers and hand against one side of the client's abdomen. Use the other hand to tap the opposite side of the abdominal wall. So note for any fluid movement. So Althea, can you place your hand here, the middle? Okay, so it is normal because no fluid has been transmitted. So now let's proceed to palpation. Position the client back into a supine position. Cover the upper and the lower body of the bed sheet, leaving the abdomen exposed. This is for us to have an easy access of the abdomen. Begin palpating to a non-tender abdominal quadrant. Use fingertips to compress the quadrants to a depth of 1 cm in dipping motion. Lift the finger gently and proceed to the next quadrant. So now begin palpating deeply all the quadrant surface to delineate the organs. Use the palmar surface of the finger to compress quadrant to a maximum of depth of 5 cm. Note for any resistance or any deep structures. And don't forget to perform by manual palpation if resistance or deeper structures is felt. So I'm going to start the palpation now. So, as I palpate, it is normal because tenderness is possible over the xiphoid, aorta, cecum, sigmoid colon, and ovaries with the deep palpation. So now, let's proceed the palpation for the masses. Use the fingertips to palpate all the 4 quadrants to depth of 1 centimeter in dipping motion. Note for any masses and its sizes in centimeter, location for its shapes and consistency, demarcation, pulsatility, tenderness, and mobility. Okay, so upon palpation for the masses, it is all normal because no palpable masses are present. So now, let's proceed to palpate the umbilicus and its surrounding. Okay, so upon palpating for the umbilicus upon palpating the umbilicus, it is normal because as I observed, umbilicus and surroundings are free from swelling, bulges, or masses. So now let's proceed palpating the aorta for us to assess the abdominal aortic pulsations, which may indicate a possibility of abdominal aortic aneurysm. So use a thumb or first finger or use both hands to palpate deeply. Then assess for the pulsations. Okay, so the normal aorta is about 2.5 to 3 centimeters wide with a moderate and strong pulse. So possibly a mild tenderness may be elicited. So now let's proceed palpating the liver. To assess for the liver contour, surface, presence of nodules, tenderness, and irregularity. So stand at the right side of the patient. Place the left hand under the back at the level of 11 and 12 ribs. Lay the right hand parallel to the costal margin. So the fingertips should point toward the client's head. Ask the client to inhale deeply, then compress upward and inward with the fingers. Note for consistency and tenderness. So Althea, can you inhale deeply? Okay, exhale. So now let's proceed by palpating by hooking. Stand at the right side of the client. Curl or hook your fingers or both of your hands over the edge of the right costal margin. Ask the client to inhale deeply and gently pull firmly pull inward and upward of your fingers. Note for consistency and tenderness. So Althea, can you inhale deeply? Okay, so upon palpating, so the liver is usually not palpable, though it may be felt some thin clients. So if the lower edge is felt, it should be firm, smooth, and even. So the mild tenderness may be normal. So now test for the cholecystitis. Press the fingertips along or under the liver border at the right costal margin. Then ask the client to take a deep breath or inhale deeply. Note for the right quadrant for the pain and tenderness. So, Althea, can you inhale deeply? Okay, exhale. Okay, so no increase of pain is present. That means it is all good and normal. So now let's palpate the spleen for the splenomegaly. Ask the client to turn into his or her body to the right side. Then palpate the spleen by moving downward and forward. Document the size into a centimeter below the costal margin. Note for any consistency and tenderness. So Althea, can you turn to this side? So, the spleen is seldom palpable at the left costal margin. Rarely, the tip is palpable in the presence of a low, flat diaphragm or with deep diaphragmatic descent on inspiration. So, if the edge of the spleen can be palpable, it should be soft and non-tender. So, let's proceed palpating the kidney. To assess for the kidney enlargement, place the left hand on the right posterior flank and provide the support. Place the right hand to the right upper quadrant, just below the costal margin, at the mid-clavicular line. Ask the client to exhale and hold his breath, then gradually release the pressure of the right hand. Repeat these steps to the left kidney. Katia, can you inhale, then exhale, then hold it for me? Okay, so can you inhale, then exhale, hold it for me? Okay, so the kidneys are normally not palpable. Sometimes the lower pole of the right kidney may be palpable by the capture method because of its lower position. So now begin palpating at the symphysis pubis. Then move upward and outward to estimate the bladder border. So note for the consistency and tenderness. So now let's perform the hypersensitivity test. Stroke the abdomen with the sharp object or grasp the fold of your skin with your thumb and index finger and quickly let go. Repeat the 102 steps to several times along the abdominal wall. Note for the pain and an exaggerated skin reaction. So the client feels no pain and no exaggerated reaction. So test for the psoas sign. So ask the client to lie at the left side. Hyperextend the right leg of the client. Note for pain and reaction of the client. So Thea, can you move your body to the left side? Okay. So do you feel any pain? Okay. Test for the obturator sign. Hold and support the client's knee and ankle. Flex the hip and knee, then rotate the leg internally and externally. Note for any pain or reaction of the client. So do you feel pain, Katia? Okay. So, there is no abdominal pain is present for the psoas or obturator sign. So, test for the appendicitis. Assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen, away from the painful or tender area. Then suddenly, release the pressure. Listen and watch the client's expression of pain. Ask the client which it hurts more upon by releasing or by pressing. Then ask the client where in the abdomen pain occurred. So tell me, Tia, if it is if you feel pain upon pressing or releasing. Which one? Okay. So, no rebound tenderness is present. So, in the summary and closing, inform the client that the assessment is done. Assist the client to change his or her clothes. Then, reposition the client into a comfortable sitting position. The last thing is that summarize the information obtained during the working phase. Discuss the findings to the client and the possible plans to resolve the health problem if present. So assess the client for further understanding and teaching. Then don't forget to provide the client the opportunity to ask for his or her concerns. Don't forget to perform hand washing to prevent the spread of the microorganisms. Then document the findings to the medical record of the client. Then lastly, don't forget to thank the client for his or her cooperation. So, hi again, Althea. So, upon assessing for your abdomen, it was all good and normal as the result a while ago. So, all you can do is that just keep your lifestyle habits good, then intake take nutritious food, fruits, and drinks. And if you feel uncomfortable, feel free to come back here so that we can run another assessment. So, do you have any clarifications or concerns? Okay, so thank you so much and have a nice day ahead.